Hey guys, Dr. Nicholas Beasley here from Woodgie Medicine. In today's video, we're going to talk a little bit about how to support your treatment program, how to enhance the treatment program, but also how to speed up recovery. So most of the time when patients come into clinic, I'll be using acupuncture to treat specifically pain. Acupuncture is a really effective treatment for pain, and what happens a lot of time, people come in with chronic pain, neuropathic pain. We use the acupuncture and we can generally get the pain down quite significantly at the time. Now what happens is, as the body starts to compensate and goes back into its old patterns, the pain may usually come back in 2 or 3 days. To lengthen and to enhance the treatment effectiveness, I really recommend patients avoid doing any exercises that triggers any pain to an area. For example, let's say if we've got lower back pain and certain stretches, certain exercises or certain postures cause that pain to come more than others. What I really recommend is that the patients trying to avoid bringing on that pain, whether it's through exercise or whether it's through any activities. And it's okay just to allow some colleagues to do some work, or it's okay to try a different exercise that doesn't cause that pain. Because what happens is, when the body or the midbrain perceives the pain in an area, it will lower the neurovascular function, or basically the blood flow to that area, and actually weaken the muscle, causing a stiffness in range of motion, and then over time it creates like a negative loop where there's more pain, and it's generally like going to trigger off a reaction which basically keeps us in a loop state of chronic inflammation and chronic pain. So what we want to do is we want to be choosing exercise routines, or want to choosing activities which don't involve triggering the pain or making the pain worse. Now it sounds really simple and it sounds really easy, but let's say if we're using our shoulder and I've got to go to work, it can be really difficult to avoid them particular movement patterns. However, if it just means temporarily for a few weeks, you just have to do certain exercise, certain movements, or have to tell the boss if we can do certain other activities, it will have a significant effect on your treatment outcomes. And that when you are coming for treatment for pain, generally speaking, the treatment is not just the half an hour or the 1 hour in the treatment room. It involves a few weeks of multiple things such as exercise, corrective patterns, and trying to avoid any further irritation to the area. So what I often advise patients, especially those who like to work out, is that to basically adjust their program towards exercises that do not cause any further irritation. Even if that irritation is a 1, 2 out of 10, what happens is the brain is now perceiving more and more pain in there. And with the acupuncture, we're trying to tell the brain that there's no pain there. So it ends up being a bit of a tug of war of what's going to be stronger, the analgesic of the acupuncture or the stimulation from the exercise. So what we want to do is we want to also incorporate the use of hot packs. So hot packs are really beneficial. 9 out of 10 people with chronic pain, it's going to be to do with restricted blood flow. In cases where there's a lot of heat in the area, it's common sense not to use hot packs, but most of the time if it's a neck injury, lower back, like stiffness and pain, heat packs, hot water bottles, they're going to be really effective. We also have like herbal patches and certain liniments which are really useful to increase blood flow to that area and improve it. So I do really recommend that people still exercise and keep doing the activities, but they have to be very mindful and just adjust the program temporarily. The more I see people in the early stages of treatment, 2 to 3 times a week, the faster we're going to get that result, and the better it's going to be long term for the patient's recovery. So, if you've got any individual questions, please send me a message, let me know. But just generally think that any activity that I'm doing which is stimulating some form of pain or discomfort, you're actually going against the grain, you're actually going against what we're trying to achieve with the acupuncture. And often you make the condition worse. Okay, so I hope this video has been really beneficial. I hope that you can share it with some friends and family, and if you've got any questions, just send me an email. 谢谢